What is answer therapy? ANSSR is the acronym for Autonomic Nervous System Self-Regulation. ANSSR is a phenomenon that happens when you achieve a unique state of relaxation. In that special state, your nervous system can actually heal chronic pain. Your body already knows how to heal chronic pain. You simply need the right support for your nervous system, which means medical-grade relaxation. ANSSR therapy gives us predictable access to our natural pain healing process. My name is Andy Arneson. I'm the founder and the only practitioner of ANSSR therapy, which I started developing in 1992. I specialize in injury-related chronic pain, but other applications are discussed in Part 5. ANSSR therapy outperforms every pain management method because it's not pain management. In this video, I'll introduce you to the logic behind ANSSR therapy. Exhibit A. According to the CDC, more than 20% of American adults have chronic pain. Half of those cases are caused by injuries. Exhibit B. We have a massive pain management industry. When people hear the term pain medicine, they think pain management. They don't expect to see a method for pain elimination. When you put these data points together, you might conclude that the human body cannot heal injury-related chronic pain. It can heal the injury, but you'll be stuck with pain for the rest of your life. That doesn't make sense. The human body can heal terminal illness, systemic infection, and a million other conditions. Healing an injury is a miracle of tissue repair. Compared to that, healing pain should be easy. So is our natural healing ability flawed? Is there some evolutionary advantage to being unable to heal chronic pain? I suggest we assume that your body knows how to heal chronic pain. It's a matter of finding the support you need for healing, which is what we call medicine. Exhibit C. We have something called standardized medicine. Medicine can be standardized because we know how body systems respond to proper support. We can predict the outcome of many procedures. For example, if you take an antibiotic for an infection, we can predict how your immune system will respond. So why don't we have a standard of care for chronic pain elimination? Why do people have injury-related pain decades after the injury heals? Most of my clients have had injury-related pain anywhere from 10 to 50 years, a lifetime in some cases. Since the 90s, they've reported pain elimination in 2 treatments on average. Why did they need to wait so long? Because proper support for your nervous system does not yet exist in mainstream medicine. We know a lot about the immune system, cardiovascular system, etc. We don't know that much about the autonomic nervous system, which produces our biological stress and relaxation responses. Why does that matter? Musculoskeletal pain is produced by the stress response. Stress response means contraction of body tissues and organs. That's what causes a painful muscle spasm. The remedy is biological relaxation, which relaxes the stress response and stops your pain. In other words, your pain relief is already there in your body, a basic function of your nervous system. The question is, how do you access your built-in pain relief? Stress implies discomfort. Relaxation happens when you get comfortable. To access your natural pain relief mechanisms, you need physical and emotional comfort as much as possible. We have systemic comfort and also local comfort in one spot. If you have chronic pain, you need both. So that's how pain medicine works in general, even drugs and surgery. Practitioners might not talk about pain relief in terms of relaxation. They're more likely to talk about it in terms of anatomy, like taking pressure off a nerve with surgery or manipulation. But why would they do that? Because it's their way of giving you comfort and relaxation. Next question. In every situation where someone goes from discomfort to comfort, from stress to relaxation, there's an automatic process that produces comfort. For example, you get a massage and you feel relaxed. Why did you relax? Can you explain that process? It's important to understand this because someone else might have more stress after massage. Something went wrong with that process. It's basically the same process in any medical method or life experience. Why does relaxation happen or not happen? Now here's the punchline. No one understands that process. Medical doctors, psychotherapists, massage practitioners, none of them know how discomfort is converted to comfort. They know it happens if they follow the right procedure. They can look at your biochemistry or brain waves after that procedure, but that data does not tell us why the procedure helped or failed. So the problem is the benefits of pain relief methods are limited because practitioners don't understand how or why relaxation happens. They cannot improve their results beyond a certain point. They don't know what happens if you get even more comfortable. So they never witness the healing responses that happen in answer therapy, which result from absolute comfort. Even practitioners who use a relaxation method cannot get the same responses because they're not aiming for absolute comfort. That's why the benefits of answer therapy are my own discoveries, because absolute comfort is a new phenomenon in medicine. So on the one hand, practitioners know that relaxation is essential for pain relief. On the other hand, they don't know how or why relaxation happens. So what are practitioners doing? They're guessing. Pain medicine is a guessing game. That's why we have epidemic levels of chronic pain despite a massive pain medicine industry. Answer therapy is the next big step in pain medicine because it provides the support your nervous system needs for predictable healing. In other words, it could be the standard of care for pain elimination. I've been studying that conversion process since 1992. I explain it in part 3. It's a radical new science. I call it the science of eliciting comfort, making people comfortable for medical benefits. It's the science of comfort, which means you will become super comfortable, to the point where your nervous system can heal injury-related pain and other problems. In fact, I guarantee dramatic improvement. For the vast majority of injury-related chronic pain cases, pain elimination is predictable because that's how the nervous system responds to absolute comfort. What I'm presenting in this video series is new medical science and new behavior science. So I need to present the information in steps over several videos.